So we got a 911 call stating that they were bringing in a 36-week-old pregnant female that was hypertensive and seizing. So we immediately called OB, told them what was coming. When she came through the door, as soon as I laid eyes on her, we did not waste no time. We brought her straight up here and got her in the bed, and stuff went downhill from there. She rapidly declined, and it ended up being a cardiac arrest.
This is something rare. It's rare in a busy facility, but for our low volume facility, it's very rare, and our ability to handle this was amazing. And the teamwork, I've never seen greater teamwork.
You know, there were so many different staff members involved that really acted quickly. You know, we do our best to prepare for emergencies, and preventing emergencies is the best thing that you can do. But then the second best thing that can happen is recognizing it and acting quickly, which is what everybody did.
He said I woke him up that morning pretty much kicking my feet against the floor. He said he could tell that I was having a stroke. He said my mouth was drawn, having trouble breathing. Said he called for the squad and said that even the squad people said it was a stroke, and then said I had a seizure on the way down here.
When she came through the door, I mean, she was on an EMS stretcher and she was post-ictal. She was on her belly, moaning, groaning, and I knew this was a bad situation.
Usually in a situation like this, you have 5-6 minutes to really get things turned around or deliver the baby before things go really bad.
Life is fickle, and you can do everything right and still have a bad outcome. You know, I was hoping that everything would work out, and this was a different situation than what we usually see, because we're not dealing with just one human being, we're dealing with two, mom and baby, and we really needed to make sure that we did the best for both. Luckily, you know, everybody was doing 110%.
Thankfully, the baby did have a good heart rate when he was born. Thankfully, we didn't have to resuscitate him with compressions. We did give him oxygen, but he started crying, and everyone in that room just kind of couldn't believe it when the baby started crying.
Everyone was really focused on what they were doing and their job in that moment. The room was quiet, and the baby let out a cry. And we all just stopped what we were doing and looked up, and we're like, the baby is crying. We kept working with the mom, and in minutes after that, we had a faint heartbeat on the mom. And it was a miracle.
We have a low volume. This isn't something we see all the time, so we do drills to keep us prepared, keep us fresh on what we should do in these high-risk situations.
So in these rare events at not only a low volume hospital, but any hospital, something like this would be rare. The only way that you have to prepare is drills.
But because of that, because of the focus on making things better, I think we gave this, we gave our patient and both patients, mom and baby, the best chance of survival we could.
So I'm so thankful our nurses that were there came up and helped us that day. And then Dr. McVeigh and Dr. Prees, they were both wonderful, and all of them together, everyone together is what saved her life.
Everybody made a difference. If one person had not been in that room, I don't know that our outcome would have been the same. Every single person that was in the room was important.
I tell them thank you, and I really appreciate it. If it wasn't for them, then probably wouldn't be here without this hospital.
We have people that travel even 30, 40 minutes just to get here, and that's the closest to them. So I feel like it's essential that we're here and we're able to care for them, and feel like it's a huge asset to our community, and it makes me happy knowing that I'm able to help in such a rural community, you know, and take care of our patients and make communities healthier.